We're going to switch gears a little bit to the world of eye care. So diabetic retinopathy, which is the eye manifestation of diabetes, is still the leading cause of vision loss in the US, which is crazy to think about because we actually have great treatments to reverse vision loss from diabetes, as well as prevent vision loss in the form of lasers and intravitreal injections that we heard a lot about through our SOS challenge a couple of years ago. And if we initiate these treatments in a timely fashion, we can reduce the risk of blindness by 90%. Next slide. And so some of you might be thinking to yourselves, well, then if we have such great treatments, then why are people still losing vision? And it's because people are not getting the eye screening that they're being recommended. So both the American Academy of Ophthalmology and the American Diabetes Association have been very clear in their guidelines in recommending that patients with type 2 diabetes get an annual screening eye exam at the time of their diagnosis, and then at least annual eye exams thereafter. Next slide. And part of the problem is that there just aren't enough ophthalmologists. So you can see a density map of available ophthalmologists in the US, where darker colors means more available ophthalmologists on the left. And on the right is a prevalence map of where patients have a lot of diabetes. Again, darker colors means more patients with diabetes. And you can see very clearly that these maps are not overlapping and there aren't enough ophthalmologists to screen all patients with diabetes. Next slide. But sending your patient with diabetes to the eye doctor like me is not the only way that we can perform diabetic retinopathy screening these days, because there's a lot of new technology. For example, in telemedicine, you can install these fundus cameras or cameras that take a picture of the back of the eyes anywhere, really, for example, at your primary care doctor's office. And these cameras can take pictures, send the picture to be read by an ophthalmologist, and the ophthalmologist can say, okay, this person can be screened remotely going forward, or, we see something really concerning, they really need to come into the office and see us. And the more exciting new technology is the use of artificial intelligence, where, again, you can install these cameras really anywhere. They can take a picture of the back of the eyes, and artificial intelligence automatically can say whether or not this person needs to go see an ophthalmologist. So this last method here is completely without the need for an ophthalmologist like myself. Next slide. So the purpose of this proposed network study would be really to characterize our current landscape of how we're doing diabetic retinopathy screening. With all the advent of this new technology, are we getting our patients with type 2 diabetes screening? What's the choice of this initial screening and kind of a treatment pathways? Which ones are they going to? And are patients who are initially screened with autonomous AI, are they eventually making it to the eye doctor's office? Because we expect some of those patients will and eventually need to see us. And what's the baseline characteristics of these patients who are getting these different types of screening? Are we getting into those rural areas or underserved areas with these new technology? And are we really reducing the amount of time that it takes from diagnosis to their initial screening with all of this new technology? And last slide, Craig. So if you are reading this slide, it means that you are using your vision and hopefully care about vision health. So please vote for the 2 eye care studies, including this one, and you'll hear about another one from Michelle in a little bit. Thank you.